and welcome to the next webinar. This is around eating healthier and hopefully give you a path to enhanced well-being and vitality. This is part of the program of work, Your Health, Your Well-being and Your Numbers. And my name is Helen Donovan and I'm working alongside my colleague Lola Kahendi, and we're both associates in nursing at C3 Collaborating for Health. C3 Collaborating for Health is a charity aiming to reduce the non-preventable disease, the chronic diseases that are preventable, non-communicable diseases, things like diabetes, cardiovascular disease, all of which can be supported and helped by us living healthier. Now, there's a lot of stuff out there on the internet. You go and look and see, you should be doing this and you should be doing that. And part of this work is to try and help navigate the facts from the myths, to give us some assurance that what we're looking at is accurate. And one of the ways that we would recommend that you do that is look for this sign, look at this PIF tick. And the PIF tick gives you some assurance that the stuff that you're looking at is reputable. Have a look. Is there a date? So is it current? Where does the information come from? Does it look professional? Is it actually trying to sell you something that you probably don't need? And does it include sources of information and references so you can back it up? And is it backed up by other organizations, all really good things to look at and to make sure that you are actually looking at reasonable, reputable bits of information. Now, eating healthier, be honest with yourself. How healthy is your diet? Really, really important that we think about a balance. Now, I'm sure most of you have seen things like this, the healthy plate. And it's just a way of visualizing that when you look at your plate of food, most of it should be made up of fruits and vegetables. About a quarter, palm-sized portion of protein, so whether that's meat, fish, pulses, lentils, other forms of protein, and then about a quarter from grains and carbohydrates. And try and make sure that you're looking at whole grains. They absorb better, more slowly, they take longer for your body to digest and make you feel fuller for longer. Don't forget things like water, really important that we drink enough water. A little bit of dairy is fine as well, but not huge amounts. And make sure that you have a little bit of fats, healthy fats, olive oil, really good for our overall system, keeping everything going. So we want to understand the nutritional basics, a balanced diet, healthy eating. Now, again, I'm sure most of you have seen things like this on the back of many food packaging. You've got this, what's sometimes referred to as a traffic light. So too much red gives you an indication that it's high in calories, high in fats, high in sugars. So have a look to see, and of course, the nutritional basis of this. Um, and taking it on its own is probably not very useful. What you want to make sure is that you've got this balance. So we sometimes talk about macronutrients, nutrients, and micronutrients, and I'm going to just sort of touch on these. I'm not going to go into any great detail. But macronutrients are those things like proteins, carbohydrates, and fats, and they're all really important. We need proteins. They're vital for tissue repair and muscle repair, and they produce enzymes and hormones. So really important for us to be healthy. Carbohydrates is our energy source, the main supply of energy for our daily functions and exercise. And as I said before, if you can eat whole grains and whole carbohydrates, they tend to be absorbed more slowly and make you feel fuller for longer. And fats, again, they're not the bad guys at all. You need some fats to store energy, to protect our organs, and to help absorb some of those nutrients. So we need all of it. Micronutrients are those vitamins and minerals, and again, really, really important. They give us immune support, they help our immune system function. They help our bones, keep them both strong, calcium and vitamin D particularly, and you will get most of the micronutrients that you need from a diverse diet. Some people are lacking in some vitamins and they may need additional support, but be very, very wary of claims that suggest that if you take one or two of these micronutrients, it will change your life, because it really doesn't work like that. You need a diverse, balanced diet in order to be healthy and to have the micronutrients that you need. Most of us saying that probably need a little bit of vitamin D in our diet, particularly in the winter months when you're not being exposed to sunlight. But other things, think about how you get it from your diet. Whole grains and refined grains. Now, I've mentioned this a little bit, but nutritional benefit for carbohydrates can't be overstated. We need them. But whole grains give us more fiber and nutrients than the more refined grains. So, thinking about brown bread right, as opposed to white bread, brown rice, brown whole grain pasta as opposed to white rice and non-whole grain pasta. It helps our digestive health and it also gives us that sustained energy boost throughout the day. Thinking about the nutritional benefits as well of fruit and vegetables, I'm sure you've all heard of the 5 a day challenge. And actually, really, 5 a day is the minimum. We should be aiming to have more than 5 portions of fruit and vegetables in a day. And that will help disease prevention, lowering the risk of chronic illnesses, and overall improving our health. Helps us feel healthier and have a better well-being to our lifestyle. It also improves the colour and the overall appearance of the plate. I mentioned water before. Just important to maybe note that we're made up as human beings 60% water, so it's really important that we do drink enough fluid. And tea and coffee is fine, but remember if they're caffeinated, they will act as a diuretic as well. So you do need to drink water. You need to drink other things to make sure that you maintain that hydration. And it will also overall help your body be maintained. I'm sure some of you will realize that if you haven't had enough water in the day, you might feel a bit headachy, a bit achy. Water also helps our digestion and it also helps our temperature regulation, particularly if you're feeling a little under the weather. Drinking fluids can really help you feel a bit better if you're beginning to feel a bit under the weather. Variety of foods. Variety is the spice of life, as they say. So having groups of different groups of food and having that balanced plate that's colourful and appealing to look at makes meals more enjoyable. And having a diverse colours and textures not only is good for our overall what we're taking in, our nutrient benefit, but it just makes you feel better as well. So thinking about all of those very obvious times dealing with cravings in emotional eating, food is often used as a comfort and as a crutch, particularly if you're feeling a little bit vulnerable, if things are not going quite the way you want them to do, if you're feeling a bit stressed or tired. So just be wary of that. And if you are in one of those situations, try and think whether you can have something healthier. Maybe something, some fruits or some vegetables, have those available rather than all reaching for the more sweet foods that will give you an immediate burst but won't be sustained. So try healthier coping methods as well, like maybe meditation, mindfulness, and exercise rather than resorting to snacking in between meals. Think as well about your portion size. We probably all eat far too much and more than we actually need. And I quite like thinking of our hand because we most of us are able to look at our hand or imagine a hand and think of a palm being your size of your protein portion. Thinking about a portion serving of vegetables is a fistful of vegetables. Carbohydrates is a cupped hand. So if you think about a jacket potato, if it fills more than a cupped hand, it's too big. You don't need that much. Try having half a portion. And a serving of fats is often referred to as a thumb size, and that it gives you a good indication of the amount that you should be taking in any one portion. The NHS 5 a day is quite useful for this. Meal planning, again, so you're not tempted to sort of reach for something convenient at the end of the day when you get home. So try and think what you're going to have throughout the week, and it reduces the waste as well, so it keeps the costs down, buying only what you need. If you can buy in bulk, if you've got access to a freezer, use a freezer. It's a really good way of, again, not having to think about cooking every day of the week, and buying seasonal produce, so it's often cheaper and fresher, and you can then freeze it and you've got it ready to use when you want it, and it's generally cheaper to do that. Thinking about, having food that you can take into work. And I know a lot of the care homes also encourage their staff to eat the same food as the residents. And that, obviously think about how healthy that is for you, but it can also keep the costs down as well. So saving time and cost, if you can't bring food in, but be very careful about, going to the local corner fried chicken place, because invariably not healthy, is going to cost you more. So all in all, is not something that we want to advocate and encourage. We all like going out on occasion. It's a nice treat. It's often something that we do to celebrate. But try to think about what you're choosing. So choose grilled food options, so grilled fish, grilled meat, as opposed to fried food. Having a salad is great, but very often the amount of dressing that is put on restaurant salads means that they have as many calories and as many fats as something that's more obviously not so good for you. So ask for your dressing to be on the side, and then you can just put a little bit. And think about the size of the portions that you're consuming. Many restaurants do have very, very big portions, so think about that. Maybe share food, but think about taking food home, um, so that you can get two meals out of it in a way. So think about, again, this is making things sustainable. So gradual changes are going to be far more effective and long lasting than short-term diets. Short-term diets may work in the short term, but some of the evidence suggests that people put on the weight and then more. So try and make whatever changes that you're doing sustainable, something that you can live with. Track your progress helps to maintain your motivation, but don't weigh yourself, get into the habit of weighing yourself every day, because that can sometimes be demotivated. We all have fluctuations. Set achievable goals to maintain the commitment, and celebrate small victories. So, maybe treat yourself to going out, or maybe to a new piece of clothing, or whatever it is that keeps that engagement and that focus. Um, and the well-being people, the kiosk that many of you have had in the care settings, has a program that goes alongside it, Habits for Health, which supports the kiosk. So keep an eye on for that information and sign up to using it. And finally, really please do tell us what you think about these webinars. So follow the QR code on this slide, just follow that on your phone, click on the recording of the session that you've watched, and then complete the online form and give us your feedback. Thank you very much for listening. I hope you've enjoyed it, and I'll see you again on another